You've probably heard the phrase, 10 minutes with the GP if you're lucky. In the United Kingdom, that is not just a cliché, it is the reality of our medical system. 10 minutes. 600 seconds. From the moment you walk into the room, the clock is already ticking. For many patients, this feels astonishingly short, and if you've ever left a consultation wishing you had more time, you are not alone. GPs feel exactly the same way. Today we're looking at what actually happens in that window and why it so often feels like it isn't enough. From the outside, it looks like a brief conversation. But inside those minutes, a GP is performing a complex mental marathon. In a single slot, we must listen carefully to your story and clarify the timing of symptoms. Review your medical history, medications, and allergies. Consider family history and specific risk factors. Perform a physical examination if necessary. Decide which conditions are most likely while ruling out serious illness. Explain the diagnosis and discuss treatment options. Arrange blood tests or imaging. Provide safety net advice and document everything accurately. May sometimes need speak to other services or refer the patient to the hospital urgently, and also arrange emergency transport to the hospital. Sometimes the consultation is straightforward, like a sore throat or a urine infection. But physical illness is frequently intertwined with emotional stress, family pressures, and financial concerns. All of that can surface in the same 10-minute conversation. To understand why time feels so limited, we have to look at the wider NHS. General practice handles roughly 90% of all NHS patient contact. In England alone, GP practices deliver around 30 million appointments every month, well over 300 million a year. Yet, our appointment slots remain among the shortest in the developed world. In many European countries, routine consultations are 15 to 20 minutes, and in the United States, they are often longer. British GPs don't care less. The system has simply evolved under extraordinary demand. Let's look at a common scenario. A patient books an appointment for back pain. As the talk unfolds, a deeper story emerges. They haven't slept, work is being affected, and they are terrified they might have cancer. This is no longer just about back pain. It's about fear, uncertainty, and mental well-being. Now look at the GP's side. They are 1 hour into the clinic and already running behind. She came in very early, before the surgery opened, and spent the morning reviewing abnormal blood results, signing prescriptions, and handling urgent admin. Her next patient has chest discomfort. Within minutes, the GP must determine, is this muscle strain, acid reflux, or the early signs of a heart attack? The weight of missing something serious stays with a doctor long after the patient leaves. One of the least visible aspects of the job of a GP is the mental workload. We must use pattern recognition and constant vigilance to distinguish common illnesses from rare, dangerous conditions. This is the central tension. Patients need more time, and GPs want to provide it. But the population is growing and the workforce hasn't kept pace. If a consultation feels hurried, it usually isn't indifference. It is a GP concentrating intensely to provide safe care within a constrained time frame. To make the most of your 10 minutes, try these simple strategies. Arrive at the surgery early for your appointment. Think about your main concern before you arrive. Prioritize the most important issue first. Mention early if you are especially worried about something serious. Ask if another appointment is needed for additional concerns. The honest truth: 10 minutes isn't enough. Not for you, and not for the kind of healthcare we would ideally like to provide. But within those minutes, there is listening, clinical judgment, and genuine effort. This is the diary of a UK GP. If you've ever walked out wishing there had been more time, please know your doctor likely felt exactly the same. Trust doesn't rebuild through arguments, it rebuilds through understanding. Let's keep talking.